Welcome to the Baby Development Podcast, where we empower parents one milestone at a time. I'm your host, Cherrick, a pediatric physical therapist with over 20 years of experience helping infants move, grow, and thrive. If you're a parent and you've ever noticed your baby always looking to one side or the other, or they're developing a bit of a flat spot on the back or the side of their head, you're not alone. Today, we're going to do a deep dive into a condition called congenital torticollis and what it means that you can do to help. So let's start at the beginning. What is torticollis? Torticollis, also known as congenital muscular torticollis, is when a baby's neck muscles are tight or shortened on one side, and this causes baby's head to tilt to one side while turning or rotating towards the opposite side. It can affect the way your baby looks around, the way your baby feeds, and eventually how your baby rolls, sit up, crawls. And so the earlier we recognize it, the better. Well, here are a couple of other names that you might see out there on the web and on social media. Some of the names you might hear, but they all mean the same thing. You might hear the term wry neck, head tilt, infant congenital muscular torticollis, or in some cases even twisted neck or bent neck. And they're all describing the same condition involving tightness in one of the key muscles on the side of your baby's neck. This muscle, the sternocleidomastoid, or the SCM for short. So let's take a break and talk about what causes torticollis. That's a great question if that was the question popping into your head. Some babies develop torticollis due to their position in the womb, especially in breached or cramped positions. For instance, if you have a baby that's a big baby and you're a small person, some sort of birth trauma or long labor, or using forceps during delivery. So here's the good news. There's a lot that you can do to prevent torticollis from becoming a problem in the first place. You want to try to do a lot of tummy time with your baby. You can start that during the first week. As soon as you come home from the hospital, you can start lots of tummy time. You can alternate baby's head position when they're sleeping or feeding. You can also change the side that you place toys or you talk to your baby from. And you want to limit time in containers like swings, bouncers, car seats, except when you're actually traveling outside. These small changes can help your baby turn their head to both ways and to avoid the muscle tightness that occurs in the sternocleidomastoid muscle. Now I'm going to walk you through two of the best stretches for congenital muscular torticollis. The first stretch is called the football hold. You can see I have my baby Annie here with me, and I'm going to use Annie to demonstrate. So if you want to watch this video later on YouTube, you can see the actual demonstration of it. But I'm also going to verbally talk you through how to do this. So the first thing you want to do is to sit down with your baby on your lap. You want to have your baby facing away from you. Now this demo is going to be for a baby that has a right side torticollis, which means that baby's head will be tilted towards her right side. Now, what you want to do is put baby facing away from you, sitting down, and you want to lean baby towards her right side, seeing that she has a right side torticollis. You're then going to take your left hand and you're going to pass your left hand in between baby's legs. Bring your hand all the way up to where you are holding baby's right shoulder down. So now you have your baby in almost like a horizontal position where baby is lying up against your chest, facing away from your body, and you have baby where you're using your left hand to hold down baby's right shoulder. Now, as you're holding down baby's right shoulder, you're going to use your right hand, put it under baby's head, and hold baby around baby's chest. And what this does is this will allow baby's body to gently glide down and stretch the right side sternocleidomastoid muscle. This is a very effective way to do this stretch because you have baby up against your body. You can now rock your baby side to side. You can actually get up and walk around the room with your baby, holding your baby in this position. And baby would be stretching your tight sternocleidomastoid muscle on the right side all the time while you're doing this hold. Of course, you want to switch everything around to the opposite side if your baby has a left sternocleidomastoid tightness or a left side torticollis. So this is a good stretch, and I like it because you can hold baby up against your body. You can rock baby side to side, and it works really well. You want to do this stretch and hold it for about 1 minute. You can do it longer if your baby tolerates it. If your baby begins to fuss or starts to cry, then it means that you're stretching your baby a little bit too much. Baby's not tolerating the stretch well. This stretch should be a slow, relaxed kind of stretch. It shouldn't be anything taut where you're actually pulling or tugging on your baby's neck. Depending on how tight or how much of a hand tilt your baby has, you may have to ease your right hand down to where baby's neck is not bent so much towards the left side. But you should be able to do this stretch and get to a point where you can stretch or bend baby's neck towards the left side until baby's left ear is actually able to touch their left shoulder. So that is the first stretch, which is the football hold. Now I'm going to demonstrate how to do the stretch to address the rotational component of sternocleidomastoid tightness or torticollis tightness. Now remember, when you have a baby with a right side torticollis, your baby's head will be tilted to the right, but will be rotated in the opposite direction. So your baby's head will be rotated to the left. So what we're going to be trying to do is to now rotate your baby's head as far as it can go towards baby's right side. So what I want you to do is, again, sit on the couch or sit in a chair. Position baby on your lap where baby is facing away from your body. And you can put baby to sit on your left leg, because now we're going to be trying to rotate baby's head towards baby's right side. And what I want you to do is use your right hand, bring it onto the left side of baby's head, and gently turn baby's head towards baby's right side. You want to make your hand big and wide as possible. That way you can actually rub baby's head and soothe baby as you're actually turning baby towards this side. One technique that I like to do is to put baby on my lap, sitting where I kind of cradle baby in my left arm, and then use my right hand to gently rotate baby's head towards baby's right side. And you want to stay away from baby's jawline or baby's mouth, or you don't want to cover baby's eyes. You want to have your hand high up on baby's head where you're actually rotating or turning baby's skull towards baby's right side. So of course, for you moms, that will mean that baby will be up against your left breast. And what you can do is you can look at baby and make eye contact with baby and talk to baby while baby is in this position and you are doing the stretch. Again, you can use this position to rock baby and talk and comfort baby as you're stretching, because you want to keep in mind that you're actually stretching a muscle that is tight. And so if you think of it as the way you feel when you're stretching your, let's say, your calf muscle before you go on a run, then this is kind of the way it feels. Stretching for some people is not the most comfortable feeling, and your baby may get a little bit uncomfortable as you're doing this stretch. What you want to do, a lot of times parents feel like they're hurting their baby as soon as baby starts to fuss. You're actually not hurting your baby. I want you to start practicing comforting your baby while continuing to do the stretch. So do things like rocking baby gently side to side, talking to baby, rubbing baby's head, rubbing baby's hair, playing with baby's hair, and using a soft, soothing voice as you're talking to baby as you continue to do the stretch. And gradually try to extend the amount of time that you're able to stretch your baby's neck muscles for until eventually you can straighten out the torticollis. Now, this is something that is going to take a little bit of time depending on how tight your baby's neck muscles are, how long the torticollis has been going on without being addressed or without being stretched. And so it might take a bit of time before you correct it. pay attention to the positioning exercises or positioning techniques that I mentioned earlier, and pay attention to the amount of times that baby is spending in containers, and make sure that baby is actually getting lots and lots of free play. And this will allow the neck muscles to gradually start to correct and revert back to where you have more balance between the right side sternocleidomastoid muscle and the left side sternocleidomastoid muscle as your baby continues to grow and develop and move. So here's the take-home message. Torticollis is fairly common, but it's also very treatable. Now, one of the most important things to keep in mind is that you can do is to try to catch it early. Look at how your baby positions their head. If you notice a tilt or a strong preference where baby seems to always be looking at the same side, don't wait. The earlier you support the movement, the better the outcome for your baby's development. This is something you want to talk to your doctor about, and also try to maybe find a pediatric physical therapist. Thank you so much for joining me today on the Baby Development Podcast. If you found this episode helpful, please subscribe and share it with another parent or caregiver or someone who is concerned about torticollis, and see if the stretches will work for you. So you want to see the stretches look like in action, you want to visit my YouTube channel, Master PT, for step-by-step with a visual demo. And remember, every baby develops at their own pace, but every movement matters. See you next time. Take care. Have a good week.